Hi, my name is Danielle Choi. My mentor is Aya Cabarello, and today I'm presenting from Concord, New Hampshire on understanding the neurological mechanisms of autism and its impact on education. So, firstly, what is autism? Autism is a neurodevelopmental disorder that is characterized by numerous social, behavioral, and communicative differences. For example, some symptomology may include sensitivity to loud noises, touch sensations, or certain smells or tastes. Another may be an avoidance of eye contact, or even delayed academic, intellectual, social, behavioral, or emotional developments, either in a school setting or a familial or social setting. So, through discovering these symptoms that are characteristic of autism, scientists and researchers have been able to develop treatments or alternative methods to help children with ASD. However, despite these improvements in the current education system, both in America and in the worldwide education system, there are many misconceptions about education with students with learning difficulties. And in fact, many teachers often struggle to accommodate to their needs and fully understand why they need to be taught a certain way. And therefore, I created a research question that would clarify these confusions and aid in improving the educational resources available for students with ASD. This is because I'm not only very passionate about this subject from a neurological or psychological viewpoint in the educational setting or academic setting, but also because I have many personal acquaintances that have been impacted by the effects of autism and have been impacted also by the educational system both in America and also worldwide, such as countries like Australia and Korea. So, therefore, this research question, which is what are the structural differences in the brain regions associated with individuals with autism spectrum disorder, and how do these differences relate to the variations in ASD symptomology? Aim to answer these questions and help to come to a conclusion. So, first of all, we have the cerebellum. The neurobehavioral studies have shown associations between the cerebellar anatomic abnormality and certain motor, cognitive, and social deficits. In autism, cerebellar activation is abnormally low during a task of selective attention and abnormally high during a simple motor task, which is unnatural or abnormal for those who are neurotypical or people who do not have a learning disorder. And for example, some activities that may stimulate verbal fluency, word generation, or semantic processing, which is all very prevalent in the setting of a classroom where you are learning things, reading things, and interacting with different material every day. These are some different activities which students with autism may be expected to impact as a result of their varied differences in their brain structure and function. And all of these functional abnormalities correlate significantly with the reduced size of cerebellar subregions. And this suggests that the structure function correspondence extends to the microscopic level of the reduction of the Purkinje cell. And in addition to this, there are many subregions within the cerebellum that associate to different symptomatology. For example, the anterior lobe is characterized as stereotyped and repetitive behaviors. So, if a teacher, for example, sees a student producing repetitive behaviors in class, for example, picking their nails, doing certain actions, writing certain words, saying certain sounds repetitively, this is characteristic of the cerebellum and its differences from a neurotypical person. And next is connectivity, which refers to the physical interconnection of the brain regions through axons, which is essentially neurons that are placed throughout the brain that help connect different regions and also help connect the brain to the rest of the body. And there is a common hypothesis that a lot of people have come to a consensus on that autism results in reduced long range connectivity and increased short range connectivity. And brain imaging shows that there are altered connectivity patterns in comparison to a neurotypical person, for example. So long-range underconnectivity is the reduced connectivity between distant brain regions, particularly between the frontal and posterior areas. And this affects high-order cognitive and social functions, which is very important in a classroom setting, as there will be many complex actions or many complex learning materials that these students will have to endure or experience. And the weaker long range connectivity may hinder the integration of information from different brain regions and leads to challenges in complex cognition and social interaction, which is another reason why in autistic symptomatology, a lot of students have trouble picking up social cues, being able to interact with others, and being able to communicate and express their emotions clearly and effectively as a result of these connectivity issues. And next is the short range overconnectivity, which is the increased connectivity within local regions of the brain, particularly in sensory processing areas, which may contribute to the hyper focus on details and sensory activities. So, for example, a teacher may see a student hyperfixating or obsessing over a certain detail in a puzzle or a math problem, or students might be very obsessed or hyper focused on certain subjects. For example, I know somebody who is very hyper focused on art and has a very niche talent towards that. And there's another thing called compensatory overconnectivity, where in some regions may help to mitigate these deficits that they have in the long range connectivity, but can also contribute to the repetitive behaviors or heightened internal focus that you see in certain students as well. And next is gray and white matter. So, gray matter is the place where the processing of sensation, perception, voluntary movement, learning, speech, and cognition takes place. So, it's a very crucial aspect of the brain, especially for early childhood development. And the white matter's role is to provide the communication between different gray matter areas and between the gray matter and also the rest of your body itself. So essentially, those with autism have enlarged total brain volume during their youth, but revert back to a normal or even reduced volume in their adulthood. And during this time, they'll experience accelerated cortical surface area or expansion, which is the area of the gray or white matter boundaries. However, this increase also comes with impaired white matter maturation, and this white matter integrity suggests weakened connections between distant brain regions, as I've mentioned before, with the long-range underconnectivity, and particularly those involved in executive functioning and social cognition, which also is explained through the symptomology characteristic of autism. And more specifically, the abnormalities in the anterior frontal gyrus, the superior temporal sulcus, and the Wernicke's area affect social and language processing. So the implications for this research, although there may be some limitations due to the obscurity in brain imaging research and the limitations within brain research in itself, overall, though, however, it will help in diagnosing autism through symptomology and also through clinical trials. And in the education perspective, it'll help in understanding the neurological mechanisms behind autism and other learning difficulties, and in turn will help develop more extensive education curriculums catered toward autistic children, where we will not only spread or promote awareness about this fact and these students, but also focus on the education of the teachers as well, who are creating these curriculums in order to cater and accommodate to these students to help them learn to the best of their abilities, and even capitalize or encourage to use some of these symptoms that are present for ASD students as a tool and as a material and resource to propel them and have a better education. Thank you.